The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have a well-known, one of San Diego's most popular cosmetic surgeons, Dr. Maurice Sherman. Dr. Sherman, welcome to the program.
Hey, thanks, Randy.
Now, mommy makeovers. Hot topic. We invited you to come on the program. In fact, I've been trying to get you on the show again for at least a couple of years.
That's
so
true.
Glad you came down. Okay, now, what type of procedures? I mean, who's your typical patient? I guess you see everybody.
Oh my gosh, we see everybody from some pediatric cases. In fact, just the other day we did a otoplasty, an earlobe reduction on a 8-year-old, and all the way up to, I think the oldest we've done is in the 80s.
What is the most popular procedure that you do?
It varies. I get asked that all the time, by the way, but it varies according to the month or maybe the season. Obviously, before the summer, we'll do a lot of body contouring work, liposuction, breast augmentation, tummy tucks. During the fall of the year, we'll do a lot of facial stuff because facial work such as facelifts, laser peels, etc., because of the fact that people are trying to get ready for the holidays. And of course, throughout the year, we'll do things like injectables and aesthetic care.
Now, I interview, our program airs throughout the U.S. and Canada, and I don't think there's a facial plastic surgeon that I've talked to that doesn't know who you are. I mean, you're a well-known person. We should talk a little bit about your background and training. Triple board certified, both in cosmetic surgery, facial plastic, and head and neck surgery.
Correct.
Is that correct? On all the programs, I always say, I don't endorse the doctors on my show. In your case, I do. In fact, my fiance needs a small procedure done. I could send her anywhere in the country. And I told her she's got to see Dr. Maurice Sherman. So
well, that's
good.
Very greatly appreciated.
And that's true. And people need to know these are real interviews. I mean, this isn't rehearsed. In fact, we didn't go over really anything that we're going to talk about today, other than I said, let's talk about mommy makeovers. So let's define that first. What is a mommy makeover?
Basically, it refers to multiple type of procedures that we do to help make a mommy usually several times over, into a more attractive person, a person who feels better about herself because of, unfortunately, some of the bad things that have happened to her body secondary to the pregnancies. And those usually consist of course, the tummy tuck, but it also can consist of liposuction, especially in the hip and love handle areas. There's also breast augmentation, very, very commonly done with the mommy makeover because of the changes, and we can talk about that
later. I've
later.
seen your photos, and some of them truly are extreme makeovers. It's about, and one of the things you're telling me off camera is you say, Randy, for certain people, that if they don't like their body, it holds them back. Elaborate on that.
Well, obviously, one could see in some of the pictures, some of the examples we have are patients who really don't have terrible bodies. Most of us, or a lot of us, might not even think of as being very, very significant, such as looseness in the lower abdomen, stretch marks. But that's enough to maybe have a very healthy, vibrant young lady who's in her early 30s never want to go out on the beach again wearing a two-piece. And that's the type of patient that we can certainly help.
What do they tell you, by the way? Okay, so they've had pregnancy, they go on the consult. What are their concerns? I mean, what do they ask you? What are the frequently asked questions?
Well, the biggest one is that these things are concerning me. I don't like to show my husband. I don't like to get undressed in front of my husband anymore.
Interesting.
I don't feel as young. I don't look as young as I feel. Is a very, very common comment because of the fact that obviously they still are working out, they're exercising, but some of these things they can't get rid of.
On a consult, by the way, and do they bring, let's say a woman, do they bring their partner, their spouse, and do you encourage that?
I encourage it because I want all questions answered, and I want all concerns. In fact, the guys usually come in, the husbands come in and say, gee, I love Mary just the way she is. Why are we doing this? I don't understand it. Is she looking at other guys?
So the guys actually try to talk the spouse out of it in certain cases?
A lot of times, yeah, they do because again they want to. I think they want.
Well, they want a natural look.
They want a natural look. They're afraid, maybe perhaps, that things are going to get worse.
Yes.
But number 2 or 3 is that they think that if they mention it to their wives are going to, it's going to compound
it is insulting.
the problem.
Right.
Yeah.
And okay, so they're in on the consult. Now, I've asked this to other doctors, but as an artist, and by the way, do you consider yourself an artist?
Absolutely,
You
yeah.
do?
You have to understand the the human form, how it works, what looks pretty, what looks aesthetically pleasing.
Do you see that end result? I mean, they're on the consult, and gravity has taken its toll, pregnancy, et cetera. Do you see the end result?
We certainly can.
I mean, do you, though, in your mind, do you say, oh boy, this is going to be good?
But absolutely true, and that's when we need to tell them that they're an excellent candidate for whatever we're talking about because the potential is there. However, there are some patients who don't have that potential, and we can improve them to some degree. So it's important that they have realistic expectations, and all that's part of the consultation.
We're moving on to the photos. So what are we looking at? Now, these are all mommy makeovers for people just tuning in. Okay.
Well, this is a very, very typical patient, Randy. This is a lady who is in her mid-40s, maybe early 50s, and she's noticing that her breasts are starting to show lack of volume and drooping.
I mean, is this true no matter what? I mean, every woman, because it's fatty tissue, I mean, it's going to drop.
Well, certainly it's fatty tissue that's going to involute or atrophy, and it's also the glandular tissue that as one gets older, because of hormonal changes, will start to also shrink or atrophy.
Okay.
So a combination of those two things will usually lead to loss of volume, especially in the superior aspect of the breast.
What does that mean, the top part of the breast?
The top part, above the nipple, and then, of course, the drooping, the sagging of the entire breast tissue. So, this is a typical type of patient. A lot of patients have these type of problems, and even though it looks very, very complicated, it's pretty routine and pretty standard that we can get some really excellent results with this type of appearance.
So that abdomen, what's going on there?
So as we move down to the abdomen, you can see this is a very, very typical type of situation that we see, oh gosh,
really, that's
every
normal.
day.
I mean, that's typical.
Oh, it's very, very common, very typical, but of course nobody usually sees it because these people want to hide this particular part of their anatomy, because even to their husbands, they don't want to undress in front of them. Oh, absolutely, all the time, because of the fact that they think this is ugly and unattractive.
So with that wrinkly area, so with the tummy tuck, and I'm not sure I understand exactly how the tummy tuck works. I mean, you're taking it out? What are you doing?
Right, well, it partially, yes, but what a tummy tuck refers to, of course, is tightening the tummy, and that means the muscles, it means the fat, and it means the skin, and it also means treatment of the belly button too, because that's a very, very important aesthetic part of a tummy. Okay. And so with some of the newer techniques that we're doing now, we can do a lot of aggressive liposuctioning and contouring of the abdomen, as well as skin tightening, muscle tightening, and rebuilding the belly button.
So it's a combination. This is this Avalar. Am I saying it right?
Correct. Avalar abdominoplasty.
And that's, for the most part, new.
It's
Where
relatively
you're doing lipo
new.
and tummy tuck together.
Well, the best part about this technique, of course, obviously, is the fact that we get great results, great looking abdomens with nice contoured tummies. But we also get our patients up walking much, much faster. We eliminate a lot of the complications of the older tummy tucks.
Could they go on a Friday, theoretically, and return to work Monday, Tuesday of the next week?
Well, probably.
You don't like them to do that.
Probably by, it depends, of course, what kind of job they're doing, but usually by Tuesday or Wednesday, in other words, 4 to 5 days, they're going to be able to come back to a sedate type of office job without any problem. So I want you to look now at her afters, and you can see in the breast area, she has more fuller breasts. They're perky, and yet they're natural. They're not overdone. They're not too large. In other words, she still can wear normal clothes, and people won't look at her or double take at her and say, oh gosh, she obviously had something done. So we just want to rejuvenate that area into
Well, it looks like she got her
look.
body back, by the way. When I look at these before and afters,
Well, basically, she
doesn't look like the same person.
She absolutely feels like it, yeah. And look at her tummy too. The after her tummy, it's
huge
nice.
Difference.
It's shaped now. She has a nice smooth abdomen. And look at her belly button. Her belly button looks normal. It doesn't have to look distorted. And also, of course, you can't see the scars because they're placed very, very low.
You say you like to put your incisions low.
Absolutely. You want to try. In fact, we tell patients bring in their low-cut bikinis or whatever garment they want to hide the scars, because there are scars, but these scars will continue to improve with time. But anyway, the point is we want to hide them as low as possible so that they feel they can put on as intimate type of clothing. So now when she goes out, she can wear these nice tight-fitting clothes and look great in them. She doesn't have to worry about any type of bulging, about holding her tummy in all the time.
Yeah, that flat stomach, by the way, is a fit look. Sexy at any age.
Absolutely.
Obviously.
Yeah. And,
without sounding superficial, I mean, it's a good look.
Even without even wearing clothes, and then of course if without clothes on in a two-piece, it's going to look even better.
So those stretch marks, I mean, that looks, my guess is about, am I about right, about that much? So you took out about that much?
We usually go a little bit above the belly button. So we're looking at, now in a patient like this, the actual size is probably no more than about 8 to 10 inches, but you can stretch that skin and that it'll be much bigger than that, because you can imagine what that tummy looked like when she was pregnant. So that's one example. And then we have the fitter patient, the patient who is in good shape, who exercises, and still has that saggy stretch mark type of skin
after pregnancy
in the lower abdomen. And this is an example of that particular patient.
Okay.
And you can see that in the pre-op picture.
Now, most women would want that body.
Yeah, but what was bothering her, and what you can't see on these pictures, is this significant amount of stretch marks that she had below her belly button.
Okay.
And that's what really bothered her. She couldn't wear two pieces. She didn't really want to even show her husband her
Do they say
figure.
that really? I mean, I've asked you that before, but I mean, do they bleed their guts on this?
Well, we hear
console?
that. We hear that time and again.
They're that self-conscious.
Yeah.
Okay.
And that's really, we don't think of it, but and we don't think of why, because the husbands certainly come in and tell us, gee, that I love my wife regardless, but to her, in her mind,
So a very
this is
fit
a very,
person,
very big deal.
Very fit person. They get stretch marks. So what do you do?
So again, with this particular patient, she doesn't have much fat. Liposuction is really not an option anymore. She needs to have that skin lifted and tightened.
Okay.
And we do that with the tummy tuck, again, hiding the scars very, very low, so that you basically can't see them in a normal type of garment.
So that's the after, because obviously, look, going into this interview and I think about tummy tucks, I think of a much older person. This looks like a very young person. So those stretch marks are gone, and incisions are low. They can wear bathing suits.
Incisions are low, and again, you can't see it in those pictures, but the belly button also looks very, very natural. So a lot of problems have arisen in the past, and I think in the public's mind, about the scar around the belly button. And that's one thing that we take great pride in trying to create a very, very natural.
So mommy makeover. Do they come in sometimes saying, I need a mommy makeover?
Well, in the last couple of years, they sure do, yeah. And I think it's because of these
And you're the mommy
shows.
makeover guy, though, in San Diego, some people say.
Well, I think we do a great job with them, and we have very, very happy patients.
Okay, good. What else are we looking at? You have some more for us.
And this is also a very, very typical type of patient. And you can see that she has not necessarily a terrible figure, but that before picture, that sagging and largeness of the abdomen doesn't look good in tight-fitting clothes. And especially when she bends over, it's very, very difficult for her to hide that.
So after pregnancy, so I understand correctly, okay, so the abdominal muscles themselves get stretched out a little bit?
Get stretched out.
You sew those back together? Like the six-pack I'm talking about.
Correct.
So
those
expands.
muscles are like this in youth, and as we have babies, and of course with age, they tend to stretch.